Hi guys, happy well, Dr. Aman here from Aurora Medical Education. A really quick video about my experience as a GP trainee doing my A&E rotation. Now I remember doing my A&E rotation, I was really worried before I went into it. I'd heard a lot of rumors about A&E, the difficult shifts, the patterns, the stuff that you see. And it was one of my earlier GP trainee rotations. I think it was my first one actually in GP ST1. And I remember having a lot of fears about it, but actually I came out of that rotation with an immense amount of confidence, a huge amount of knowledge that I built up in that short period of time. And I talk about 5 key things that I took away from my rotation that hopefully will help you if you're about to do your A&E rotation as a GP trainee yourself. So we'll cover those 5 things, and also I'll talk about how you can save 10% on any of our GP trainee related online courses. That could be our AKT courses, CSA courses, RCA courses, or even our GP Trainee ST1 Max online course. But let's start with the 5 things that I learned from my A&E rotation as a GP trainee. Number 1, the first thing I took away from my A&E rotation was the ability to trust my gut instinct. So firstly, I think I developed my gut instinct first, and then I learned to trust it towards the end of the rotation. Now, I remember seeing loads of different kinds of patients. Obviously, I can't remember all of them, but some stick out in my mind. And I remember just being able to work out very quickly by the end of my A&E rotation that this person, okay, straight away my gut instinct tells me this person is unwell. Or I'm thinking about maybe sending somebody home because their blood test might appear okay, but my gut instinct is telling me that there's something not quite right. There's something that's telling me not to make this, not to send this person home, for example. And that's something I developed over my A&E rotation, because you see so many patients of so many different varieties, ranging from very well up to very, very unwell. And that gut decision that you use so much in general practice, that ability to see someone and think within 3 seconds, okay, this person is seriously in trouble, and not just because they can't breathe or because they've got chest pain, but you have that gut feeling that, okay, this person has something not quite right. That I took away from my A&E rotation. And for anybody who does 4 or 6 months rotation, depending on what you're doing as GPST1, I'm sure that your gut instinct will be honed. And secondly, you'll learn to trust it a little bit more. See, I was developing my gut instinct over time, but I wasn't always trusting it at the beginning. But as I got towards the end of my A&E rotation, I was trusting my ability. I was like, okay, my gut feeling is telling me something, do not ignore it. And I was able to make those kind of decisions on my own, rather than earlier on, my gut feeling was there, but I was always thinking, well, this can't be right because the numbers seem okay and the patient seems okay on the surface, and therefore I was getting a lot of advice, and I was being told, actually, you know what, you need to keep this person in, whereas towards the end, my own gut feeling was doing that, and I was trusting it 100%. And when I started my GP rotations later on in GP training, that trust of my own gut instinct helped me a huge amount. The second thing I took away was the ability to hone down my referrals and admissions and make them as short and sharp as possible for the other side. Now, when you're in A&E, obviously, you're going to be admitting a lot of patients, to medics, to surgeons, to pediatrics, for example. And I remember early on in my rotation, my referral, when I picked up the phone and spoke to the doctor, was really bumbly. Like, it was just long-winded. It was like a story. I was telling him every bit of the detail. There's kind of questions in there as well. I didn't show any confidence. And I can just think now, from the other person's side, they must have been thinking, well, I don't really understand what this doctor's asking of me. Are they asking me an opinion? Are they saying this person needs to come in? They don't really sound confident. They used to ask me questions, and I didn't really have the answers to those questions. But as I went through my rotation, that process became honed down. So I started to understand very quickly, okay, what does the other person need to hear from me? What are the key bits of information that they need to keep this as short and sharp as possible? So if I hadn't done my A&E rotation, eventually I would have started to learn how to do this when I was in GP rotation, but it would have taken me a lot longer. But that skill of honing down a referral, knowing the key values, knowing the key bits of information, knowing what that person needs to hear, being confident enough to sell that story in a way that doesn't sound like I'm not quite sure, was something I developed over my 4-month rotation in A&E. And it really helped when I was in my GP rotations, because obviously even in GP land, you need to admit patients to hospital, you still need to speak to on-call doctors, and that 4 months in A&E really helped me develop those skills that I took into general practice. The third thing that I took away, and probably I'd say one of the most important things I took away from my A&E rotation, was the ability to differentiate those patients that we needed to be quick and efficient and do the right thing as quick as possible, and those patients that actually needed a lot more time. Now, I remember when I first started my A&E rotation, my perception of A&E was all about patients in, patients out. It's all about volume, quickly get the patient in, make a decision. Is it a sending home or is it a referral to a specialty? And I kind of went in with that perception. Now, for the first probably a month or so, I was trying to work with that perception that I need to do this quickly. There's lots of patients waiting. People wait for too long. We need to make decisions very, very fast. Because as I went through my A&E rotation, I got a lot more confident in realizing, okay, some patients do need a little bit more time, and some patients may need half an hour, 40 minutes, 50 minutes. Just by the nature of presentation, it could be clinical reasons, non-clinical reasons, but whatever it was, the confidence that I had in me to take that extra time, even though I knew that there were other patients waiting that I had to get to as well, only developed through time in A&E. And that really helped in my GP rotations. Of course, in GP rotations, you have your appointment slots, so 10-minute appointments. And it can get quite stressful when you see there are patients waiting and you're all trying to stick to 10 minutes. But it gave me a lot of confidence when I went into GP land that I could take the 30, 40, 50 minutes sometimes that it took, because that's just the nature of the job that I'm working in, and that patient needed that time more than anything else, more than the investigation, more than the diagnosis. And I got that from my A&E rotation, and by the end of my 4-month rotation in A&E, there were some patients that I was quite happy to sit there and talk to for half an hour, 40 minutes, and not just talk about anything, but actually adding value to that consultation and knowing that if I don't take the time to do this now, it's going to impact that patient going forward. And that really, really helped me when I went into my GP rotations as well. The fourth thing I took away from my A&E rotation, again, that super helped me in my GP rotations, is that I started to get very used to looking at protocols, guidelines, and working within their remits, but also having that knowledge to not use them as rules or as gold. And this only really developed when I started A&E, because I'd done F1 before, I'd done F2 before, and of course there are protocols and guidelines there, but to be honest, I was always around people who knew what they were doing. I didn't really have to delve into those protocols too much myself because other people were there and were just making the decisions. Whereas when I got to my A&E rotation as a GP trainee, obviously when you're in A&E, you have to start using these things. So I got very used to looking at and understanding protocols, knowing the difference between local kind of trust-based protocols versus national guidelines, and I got very used to be able to go down these kind of flowcharts and work through situations myself, and again develop the confidence to do it. I could probably do it before, whereas now I started to have the confidence to go through them. Now when I went into my GP land rotations, then I realized that these protocols and guidelines don't just stop, that they transfer, or there are different ones, but the ability to go through them and the confidence to work through decisions myself really helped me when I got into general practice. And if I hadn't done my A&E rotation, again, I would have picked it up in general practice over time. But because I'd done it so many times and I was so used to going through protocols and guidelines, but not only that, also having developed the ability to know when the guideline isn't right, when the guideline isn't gold, and that these are just guidelines, they're not strict rules, that only developed in my A&E rotation because I saw so many patients that needed me to go through these kind of protocols and guidelines. That when I went into GP practice, it was there already. I didn't have to learn how to do it, and I was able to jump in and do that from the beginning. So protocols and guidelines are going to be there for you throughout your GP training, whatever rotation that you do. But I found that my A&E 4 months really helped me to understand the balance between a protocol and a guideline, and dealing with things like gut instinct and knowing that when it's not quite right to stick to that rigid formula, and knowing and understanding that guidelines are just guidelines, but they're not rules and gold and 100% all the time. That really helped in my A&E rotation. The fifth thing that I took away, and I think this is again a really important one from my A&E rotation, was how strong the value of team is. Now, I'd worked in teams again before, multiple different teams, F1, F2, even as a medical student I was part of various teams, but never have I understood the impact of how a team gelling together can help the end product, which is the patient's journey and patient satisfaction, more than in A&E. And not just the patient satisfaction, but your own job satisfaction, how you feel yourself when you have down days, up days. And the team in A&E that I worked with was amazing. Looking back at it, it was probably the best team that I ever worked with. The way that people gelled, they become like your brothers and sisters. It's just like they're there with you all the time. They're on the same shifts as you. And this is people that I worked with from my clinical team. So my fellow GPSD1s, my A&E trainee colleagues, nursing staff, paramedics, but also the other people on the team as well. So people in the A&E department who are just based next to the A&E, so they're not in the main hospital. It just really honed down the importance of how much a team is important in both something working efficiently, but also in terms of giving you back support and your need to give support to others in that team as well. And when I went into a GP practice rotation, then I realized it's a different team, but again, it's a very tight-knit unit. I was in quite a small general practice at the time. Of course, there are huge ones as well, but there are still teams there. But that ability to be able to trust your team members, the ability to be able to look out for them, the ability to be able to realize when someone's having a bad day and you pick up the slack, and vice versa. The confidence to go to them for something, or go to them for a question or a query or something, and trust their response back to you, that I developed in A&E, and that I certainly took forward into my GP practice rotations, because when I went into GP, I tried to make sure I was working within a team, just like I was working within a team in A&E. A&E is kind of enforced on you. It's just the way that the whole system works. There are people there that are jumping in and out, doing lots of different things. Whereas in GP land, you could quite easily just go into a room, and you've got your own room, and you see your own patients, and you might come out and ask when you need queries, but you may not necessarily have that need to gel in a team. But having done that in my A&E rotation, I made sure that when I went into my GP rotations, I really put the work in to get to know the bigger team, clinical and non-clinical, and that really helped me in my various GP rotations that I did in general practice and beyond when I was working as a GP as well, because I understood the value of team and how teamwork is so much more than just dealing with a clinical situation together. And when I was a GP trainee in general practice days, when I had my days when I was on my own, I was lonely, and that I just felt like, gosh, I'm the only person here, and that team spirit, what I learned from A&E, really helped me through those times. So hopefully those 5 things helped you. They certainly helped me get through my A&E rotation. If you're about to start a GPSD1, GPSD2 rotation in A&E, then hopefully these things can be of some value to you and show you that yes, you're going to learn loads clinically, but there's also so much more that you can take out of a rotation. If you're in the middle of an A&E rotation right now and you're not finding it helpful, or you're finding it difficult, or you're struggling, you're not alone. Firstly, it's a challenging set of months that you do, or a block of months that you do in GP rotation, but maybe take away some of these things and think that, I'm only going to do A&E once. I know it's not easy at the moment, but I'm never going to get to do this again. So I want to take as much as I can out of these 4 or 6 months, and hopefully it'll swing around your rotation in the middle if you're struggling right now. But hopefully look back at these 5 things, and I'm sure you'll pick up as much as I did in my rotation as well. Now, as promised, how do you get 10% saving on any of our online academy courses? We have online academy courses for GPSD1s, for AKT, for CSA, for RCA, and quite a few others. So if you have a look at the website, auroramedicaleducation.co.uk, and have a look at the online academy, then if you see a course there that you want 10% saving on, just send me an email, aman@auroramedicaleducation.co.uk, and I will send you a code that you can plug in to save 10% on any of those courses. But I hope this has been useful. We've got so many more videos like this on various rotations of GP training, and also just GP training tips in general on YouTube, Facebook, Twitter, or Instagram, Dr_Aman_Aurora. But otherwise, I hope this really helps. Have a great day. You know the hashtag, Can Pass Will Pass. Hashtag I went with Aurora.